Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then types of fluids which you see in the synovial membrane. In the synovial fluid, any fluid can be of two types. Newtonian fluid we have, and we have non-Newtonian fluid. Okay, now again non-Newtonian fluid is divided into two types. One, we have it as thixotropic fluid. Second, we have rheopectic fluid. So let us see each of them in detail. Rheopectic fluid. First, Newtonian fluid. So what is a Newtonian fluid? Newtonian fluid, as the name says, here this fluid has the viscosity of the fluid is constant, and it is constant in relation to rate of shear changes. In relation to rate of shear changes, the viscosity is constant. For example, all gases are the Newtonian fluid and simple fluids are the Newtonian fluids. Here the viscosity is constant in relation to the shear stresses. When a shear stresses or changes are applied to a compartment, then the viscosity of the fluid in that compartment will be constant. Then it is Newtonian fluid. Then second type, we have non-Newtonian fluid. In non-Newtonian fluid, here actually the viscosity of the fluid in non-Newtonian fluid is changes has the rate of the shear changes. When the rate of the shear or the shear stress changes, then the viscosity of the fluid also changes. So it is called as non-Newtonian fluid. This non-Newtonian fluid is of two types. One, thixotropic. Second, rheopectic. Thixotropic and rheopectic. What is thixotropic? Okay, in thixotropic, so what is thixotropic? In thixotropic, actually the viscosity, the fluid viscosity of the fluid in thixotropic, it decreases as the with increased state of shears. When the shear stress increases, with increase in shear stress, when the shear stress increases, the viscosity of the fluid decreases, which is called as thixotropic. Example, synovial fluid. Then we have rheopectic. In rheopectic, when the fluids with increased viscosity, when there is increase in shear stress, when there is increase in shear stress, the fluid has increased viscosity is seen. That is rheopectic. Shear stress is nothing but the whenever there is stretching, like for example when we are walking, while we are in the knee joint, while we are locking the knee and locking the knee and unlocking the knee, during that time the synovial fluid is subjected to shear stress, and during that time the viscosity will decrease due to increased shear stress. So that is a thixotropic. So synovial fluid is a thixotropic fluid.
thank you and thank you for watching.